Hey everyone, and welcome. Today we're going to talk about a sexually transmitted infection that doesn't get a lot of headlines, Lymphogranuloma Venereum. Yeah, I know, it's a mouthful. We'll just call it LGV. Don't worry, we're going to break down the entire journey of this infection, from what causes it all the way to how to prevent it.
So here's our game plan. First, we'll cover the basics. What even is LGV? Then we'll walk through the 3 stages of the infection and how doctors actually figure out you have it. After that, we'll get to the really good news about treatment, and we'll wrap it all up with the most important part, prevention. All right, let's dive right in. First things first, what exactly are we talking about when we say LGV? Okay, so at its core, LGV is a bacterial STI. And here's what's interesting. It's caused by the same kind of bacteria as chlamydia, which you've probably heard of. But think of these as specific, more aggressive strains that cause a totally different and often more serious type of infection. Now, where in the world is this infection found? Well, historically, it was mostly seen in certain regions. But that's changing, and it's changing fast. We're now seeing cases popping up more and more in North America, Europe, and Australia. This isn't some distant problem anymore. It's becoming a global health topic.
Next up, let's get into the play-by-play of how this infection develops over time. Understanding these stages is absolutely key to catching it early.
Yep, the whole thing unfolds in 3 pretty distinct stages. Each one has its own set of symptoms, which act like clues to what's happening inside the body.
So stage 1 is, well, it's kind of like a ninja. It's super sneaky. A tiny, painless blister might show up just a few days after infection, but it heals so fast that most people don't even notice it's there. And that's a huge problem because it allows the infection to move on to the next stage undetected.
Okay, after that quiet start, this is when the alarm bells really start going off. A few weeks later, the bacteria invade the body's lymphatic system, your network of lymph nodes. That's when your immune system kicks into high gear, causing those nodes to get swollen and painful. You might also get a fever and just feel plain awful.
And this is super important. How stage 2 shows up can be really different for men and women. Men often get what are called buboes, which are those really swollen, painful lymph nodes in the groin. For women, though, the symptoms can be more internal, like a bad backache or pelvic pain, because the affected lymph nodes are deeper inside the body. Now, if the infection is left untreated, it can move into stage 3. And this is the stuff we really want to avoid. We're talking about long-term damage, like scarring and chronic, painful swelling, because the lymphatic system gets blocked up. This really shows why getting an early diagnosis is so critical.
So, with all these different symptoms, how does a doctor play detective and figure out for sure that it's LGV? Let's look at how they find the clues. A lot of the time, it starts with just putting the pieces of the puzzle together. A doctor will look at your symptoms and ask about things like your travel history, especially to places where LGV is more common. It's all about connecting the dots. But to be absolutely sure, they bring in the high-tech tools. The gold standard is a test called a NAT. You can basically think of it as a super accurate DNA test for the bacteria, run on a sample. They might also do blood work to check for antibodies, which are the little soldiers your immune system makes to fight the infection.
Okay, we've talked about the problem, and now it's time to talk about the solution. And trust me, this is the best part of the story. Let's get into treatment and recovery. Seriously, if there's one thing you remember from this whole explainer, please let it be this. Despite how serious the symptoms can get, LGV is 100% curable. With the right medication, you can be completely rid of it.
And the treatment plan is super clear. We're talking about a 21-day course of an antibiotic called doxycycline. That's it. 3 weeks of medication to knock out the infection for good. So, the path to getting cured breaks down into these 4 simple but crucial steps. First, see a doctor to get that official diagnosis. Second, and this is so important, you have to take all of the antibiotics. Third, letting any recent partners know is a really responsible and vital step to stop the spread. And finally, a retest a few months later is a good idea just to be sure it's all gone. Okay, we know the whole story of this infection now, but what if we could just avoid the whole journey in the first place? That's right. Let's talk about the most powerful tool we have, prevention. And look, the best ways to protect yourself are things you've probably heard before, because they work. Using condoms consistently is huge. Reducing your number of sex partners or practicing mutual monogamy also lowers your risk. And of course, getting tested regularly and seeking treatment right away for any STI is one of the smartest things you can do for your health.
So there you have it, the complete story of LVG, from its quiet start to its treatable end. We've walked the entire path together, and now you have the knowledge. And that knowledge is power. The power to make smart, informed choices to protect your health and the health of everyone you care about.